PANDAS is a clinical diagnosis, which means there's no one diagnostic test or finding that can make the diagnosis. You have to have several pieces to fit together to get there.
So PANDAS is diagnosed in a child who has an abrupt overnight change. They develop obsessive compulsive behaviors and or restricted eating. And our challenge then is to go back and try to figure out why. So what we need to do then is backtrack and see if there was an infection. And frequently children, we know that children are either exposed or they had an infection with strep, and so we can tie those two together. One of the interesting things is that the restricted eating is not an eating disorder as we typically think about it. It is more of a fear of eating for some reason. It could be a fear of germs or a fear that children are going to choke. So those are the two primary pieces to the diagnosis. After that, we look for other associated features such as severe separation anxiety, new onset of tics, changes in school performance, increased urinary frequency, changes in handwriting, and overall just emotional lability.
The best way to rule out other diagnoses is to think about all the other diagnoses that are associated with it too. So the pieces that come together to make the PANDS and PANDAS diagnoses include things like OCD and anxiety. And so you need to be aware of children that have OCD and anxiety. Did it start suddenly, and did it start related to an infection or infectious exposure? And in children that have sudden onset symptoms that relate to an exposure to an infection, those are patients that you really need to strongly consider PANDS and PANDAS as a diagnosis. But because there is no one diagnostic test that can make the diagnosis, it has to be a diagnosis of exclusion. And so you have to think through all of the other conditions and make sure you've ruled out any other medical issues before you get to the diagnosis of PANDS and PANDAS.
How do you make a PANDAS diagnosis or a PANS diagnosis? We have an acute onset of behavioral changes associated with an infection. So is that challenging? Yes. It is challenging because we need to be able to identify that infection. Some children who have strep may have strep that is not very apparent. And so we need to make sure that we look hard to see that we didn't miss an infection. But in general, it is an overnight change associated with an infection.
One thing that we do look at sometimes in patients with diagnosis of PANDS and PANDAS is whether they're having more infections or just having severe complications from the infections that they have. And as part of that, we will look at their immune system to make sure that their immune function is normal. When we do this, we'll take a look and make sure that they're able to make antibodies, that they've responded to their vaccines, and they have normal cellular immunity as well. This is to ensure that their immune system would be able to protect them from infections, and what we're not seeing is just an increased frequency of infections in these kids as well.
For all providers in the community who see children, it's really important to keep the PANS, PANDAS diagnosis in the back of your mind. If this is a child who you know and they have an overnight change of new onset OCD, eating changes, as in restricted eating, think about this and look for an infection. Did one of the siblings have strep throat a couple of weeks ago? And does this child have an infection that was missed? So diagnosing the condition really is not difficult. It just requires that you are aware of it and pay attention to it.
Once you get to the diagnosis, then you need to decide how far you're comfortable in going with treatment. whether you are comfortable in trying to just work with preventing and treating the infections to try to minimize the immune stimulation that's occurring, or whether you're willing to use anti-inflammatories or other treatments to try to control the inflammation and reduce the symptoms.